So our goal on this part of the training is when we're done, you'll be able to make your open enrollment elections online. And what you learned today about navigating eBenefits for OE is the same thing that you would do for making changes throughout the year for a qualifying life event. And then we'll also show you how to review your current benefit elections. This was also part that we were going to do as part of registering an account. So we're going to see those items. And we don't need.
Rin?
Yeah.
We did have a question come in from an anonymous attendee, and it sounds like they're needing to know how to reset their password. They're having some trouble creating that user ID and password.
Yeah, so it's a little bit of some differences for different people, but by and large, to do a password reset, if you are a retired employee, then you contact the health service system. You can reach us at 628-652-4700. If, however, you are with the Unified School District or the Community College District, we're not able to reset your passwords, and you have to call the Department of Technology Help Desk. And for them to be able to help you, they are going to want to know, and I'm clicking help here from like that My Apps page, they are going to want to know your DSW to be able to do that for you. So if you don't know your DSW, then call us and we'll give it to you. And I'm putting up here on the screen so you can see that, and we can put that in the chat as well. But for so if you're retired, call us 628-652-4700. Or if you're not retired, call 628-652-5000. That's our Department of Technology, and make sure you give them your DSW. If you didn't get that far or don't know it, call our offices and we can give you that, and they are able to reset your password. But also in this login and help section, there was a link here to forgot password, and it pops open into a user guide. And so if you already got as far as doing some MFA where it can authenticate it's you, you can do your own password resets, but it depends how far you got in the process. So you may need to just call the Department of Technology, but that's a great question. Thank you. Always want to make sure we got you getting the right help that you need. As part of being in eBenefits, it's a web-based system. You know, you can access it from your mobile device, your Androids, your iPhones, your tablets, your computers, etc. But it is, and it's mobilely responsive, so it'll adjust to your screen size. But it is web-based, which means you're using a browser. And so sometimes if you see some weird behavior or it's not keeping the right information, it's because, you know, it's saving cookies, it's saving some of your login credentials and preferences. And so you may have to clear your cache at times, enable pop-ups or cross-site tracking. We have on this webpage, sfhss.org/ebenefits, your additional help resources to help you understand how to do some of these things. And we're going to put that and this other link to some troubleshooting into our chat so that you have those readily available. So I'm going to flip over and we're going to actually go do eBenefits together. Now, what I'm doing is I'm going to be in a test environment. So I may have some weird data. My URL is going to be a little different. But you're going to get the gist. So I'm somebody who's already registered. I don't have to do this one-time registration. I do have to put in my correct password, however. Okay, so I'm logging in. And when you get to the My Apps portal, a couple of items I want to share with you. First, your screens may look a little different than my screens. I'm in a test environment, so I've got some different things happening. But you may also, if you're good about navigating around, find let me see if I can make this bigger. See how big we can go, huh? All right. So you won't necessarily have all these things that I have, but on the left side here, you'll see change password. So this isn't a situation where you forgot your password and you're trying to reset it. This is you already know your password because you logged in. And so you can, like if you decide you want to change it, this is how you would do it. You would click on the multi-factor section here if you decide, like right now I'm set up with secret questions, but I can decide, oh, you know what, I want to also configure using my mobile phone. So this is how you can get in and do some of these other things we were talking about. And there is an email, if I were to click on my profile up here, that's associated with this, but it is a phony email for everybody. Most everybody. It's when they first set this up many years ago, they needed some email. They talked to for retirees, they didn't know your email, so it just uses sort of a, I think your DSW, so it's not really routing anywhere. And it's not editable and it's not used and it's not what we have in our system for administering your benefits or as your employer. So it might be a little disconcerting to you to see an email here that is not your address, but don't worry about it. I'm sorry if it's frustrating or confusing, but you can absolutely ignore it. It is not used and it's not able to be changed at this time. So, but when you come into the My Apps dashboard, you've got your tiles on the dashboard page, and depending, if you work for the city or if you're retired or work for another employer, you may see different tiles on this page. But the one that you're looking for, of course, I'm in a test environment, so it says test, but I'm looking for the one that says SF Employee Portal, and I'm going to click on that tile. And that gets me into the San Francisco Employee Portal page. So we've gone from the My Apps portal to the SF Employee Portal, and I know some of you are no longer employed, you're retired, you still get referred to as employees, and some of you are employed by another employer, not through the city and county of San Francisco, you still count as being on this SF Employee Portal since we administer your benefits. So let's take a look at a couple of things. And again, yeah, please.
Hi. I just wanted to pause because it does seem like there's an attendee who's seeing how this can be kind of a confusing process. And I'm just wondering if you could sort of expand upon why the city has really chosen to have eBenefits, the advantages of having the eBenefits as opposed to just the one-on-one person or paper.
Yeah, we've been looking at that for a long time to move electronically. There's a number of benefits involved with that. For starters, you don't have to come into our offices, right? Or get to a fax machine, which, gosh, those are getting harder to find. You can just log in online, or even if you were going to someplace to fax your document, are they going to be open at midnight? So this works around your schedule, nights, weekends, whenever. You don't have to just be there during our business hours. It lets you come in, which we're about to do, and you can see information about yourself that you never saw before. So it has this layer of transparency, which is great because we find through the years that we're reading handwriting on application forms that we can't figure out what people are writing. And so we've got all sorts of things that might be like slightly off a digit on somebody's date of birth or, other inconsistencies. Likewise, we mail you information to your mailing address, but it's very possible your home address isn't right in our system because years ago you put in a change of address and maybe only the mailing address got updated. It gives you convenience. There's the extra security. There's the extra accuracy because you're in there making the elections. And it gives you that layer of transparency. And of course, during COVID, with our offices closed and everything moving more virtual, here's another reason to be able to go online. For the caller who's finding this a little bit of a struggle, please know things get easier over time, but I'm always open to hearing what are the challenges you're facing because we certainly want to make it easy and accessible to everybody. And so, but there's definitely benefits to be had. That the registration is a one-time activity, and once you've come in here and you've been doing eBenefits, and we'll go through the screens in a moment, you'll see just how simple it is. You don't have to go in and change your password. You don't have to go in and add additional multi-factor authentications. And so maybe too much too soon. When you first log in, you just get to the My Apps dashboard. In all likelihood, you only have this SF Employee Portal tile, which you click, you get to the portal, and then you click and you go into your open enrollment event. So it does get easier with time. And as I said, we have recordings and videos and step-by-steps all on the website that you could take your time with and let it really absorb. But I appreciate that change can be a challenge. So just to say, my slide, my page, my web page that I am projecting right now might look different from yours because I am an employee with the City and County of San Francisco. So I have different things that I do. I have to report my time. I get paid through this employer, so I have these extra slide outs that some of you may not. But the ones we want to focus on are my benefits, and we call these slide outs because if I click on that tab there where it says my benefits, information slides out. And if I click on it again, it slides in. It's like an on-off toggle. And when I slide it out, what's nice here is I'm seeing my current benefits. And so what you see here may look different. If you are with Unified School District or Community College, for example, we do not administer your dental, so you would not see dental in here. For retirees, for example, you do not enroll in flexible spending accounts, so you would not see those as an option. So what you're seeing here is based on the eligibility and the benefits that we administer for you. This is current information, meaning that as you go through open enrollment, you are making your elections for the 2022 plan year. They go into effect on January 1st. And if you were to click My Benefits, you're not going to see any changes you have for 1/1/2022. You will only see your benefits as they are on the day that you are clicking that tab. We'll show you where you're going to be able to print out a summary for your open enrollment elections. But this is where you can always go to look at your current enrollment. There is also a My Information you can use to take a look at your contact information and update it. And that's nice as well in terms of if you have emergency contacts as well that you'd like us to have. I will say that for Unified School District or Community College District, we do not let you update your information on our side. That is at the request of your employer because they are your employer, they are the system of record, so they want you to update your address information there, and then they will get that information over to us. So the bottom, is there a question, please, Holly?
Hi, Rin, thanks. Someone's actually asking if there's an app that that they can download to get to this location.
Thanks for the question. We do not have an app, but as I said, all of eBenefits and the employee portal page is mobily responsive. So when you go to myapps.sfgov.org on your browser, on your smartphone, it'll pop up nicely, and you could always just create a shortcut or a link that you save on your phone if you prefer to do it that way, so you're not instead of an app. But no app. Thank you for the question.
And then, Rin, just to be clear, because I'm not quite sure if the Oracle Mobile Authenticator, is that an app?
Oh, thank you for that question. That is an app. All that the Oracle Authenticator does is it's one of the 3 options you have for multi-factor authentication. And so it's one I use as well. And so what happens is, like, if you choose a phone, for example, you get a text message a lot of times, like you could be using Amazon, you could be using your banking, you could maybe even have it set up for your Gmail, where it might send you a code, and then you've got to be like, type in the code, and then you're clear to go. Well, with the Authenticator apps, normally what's happening once you've linked them is it's popping up with a number, and you either say approve, or you look at your app, and whatever the value is in your app at that time, you type that into the where you're prompted for MFA. So yeah, the app is really just for that multi-factor authentication piece. It's not an app of eBenefits.
Great, thanks for the clarification.
Sure, those are great questions. The bottom half of this page, and again, this will look different. You may not have a tab that says My Team or My To-Dos, but you should have an alert tab. And during the month of October, we put an open enrollment alert right here for you. So it's a quick in right into the open enrollment workflow. But before I get there, I'd like to show you another section of this, and that's under My Link. So the one you select becomes white. You may not see manager links if you're not working for the city and you're not a manager, and you may not have work links if you don't work, but you will have employee links. And how many employee links you have, again, depends on your role with the city and county, if this is who you're working with or not. I've made it super big so I can scroll down and you can see these, but there's a section that says eBenefits. And in there, one of the links is open enrollment. And so that's the same as that alert tab that we've put on the first page. During the year, if you had a qualifying life event, so these are examples of when you can make your enrollment changes at a time outside of open enrollment. Open enrollment, you can make a change, whatever change you want and for whatever reason. Other times of the year, you can only make changes under certain rules, such as you were married or you adopted, you were divorced, your spouse lost coverage through their job. So there's only certain rules about when you can make changes to your enrollment outside of an open enrollment period. So those would be submitting a qualifying life event. We do describe those on our website. And so that's the other real important link to look for. And when you do those, we all get into eBenefits. So I'm going to use the alert tab to do that. And so I'm going to click on that. And then it's going to open up and we're going to get right into eBenefits. So I've already been in here because I've been doing some training. So let me orient you a little bit. But up here, right under where it says enroll in benefits, these little circles up top here are my breadcrumbs. And they give me a visual indicator of where I am in the process. And my first two are in green because I've already been in here. But for you and your very first time coming into this, none of these will be colored yet. And as you step through the screens, they'll change color for you so you know where you are. The first page that we get to is where we are reviewing our dependents. What you'll see here are your Ben eligible dependents. If you have a divorced spouse or ex-domestic partner or a deceased spouse, for example, you would not see those in the system. Assuming we know they're deceased and divorced, that is to say. If you have a new dependent you want to add, so this is somebody you didn't previously cover through a health service system, you'll click on the Add a New Dependent button. There are certain fields that are required, and there's an asterisk that precedes the field name, and that's your clue they're required. For example, first name, last name, date of birth, gender. Social Security number, you will notice, is not exactly a required field, but that's because some people might be adding their newborn child who does not yet have a Social Security number. However, if you have somebody other than a newborn and you do not give us a Social Security number, we will not add them to your benefits. So you do want to make sure, even though it's not a required field, that you are providing us that information. And the other thing I want to really call out here is the relationship to employee. Because if you look at this list, and while you may or may not be able to see that real clear, but there are a lot of relationships listed on here. I've got things like great-grandparent and my in-laws and neighbors. However, if you were to select some of those are not benefit eligible positions or relationships through the health service system. We have all those relationship types in there because you can also use this to designate beneficiaries. So for example, if you have a life insurance policy, there aren't the same rules about who you would like to designate as your beneficiary or maybe even an emergency contact. However, if you're adding a dependent because you're trying to add them to your benefits through the health service system, then the only benefit eligible relationships are child, domestic partner adult, a domestic partner child, other child legal, and what we mean by that would be dependents from court-ordered coverage or guardianship, those sorts of things. And then we have something else called other IRS, non-dependent adult, non-dependent child. And these are also domestic partners. However, these are domestic partners who qualify for tax-favored status. So those are the only relationships that account for benefit eligibility. And so if you go through and you add a dependent here, and then as you go to add them to coverage, they're not showing up there, it might be that you selected an invalid relationship type. So that's just some important information to know. Again, a few more items that are required, such as marital status, whether they're a student or a smoker. If you click save, so I didn't enter anybody, so I'm just going to X out. But once you click save and you're back to that dependents page, that person's name is going to also be listed here. Now I'm going to click Save and Continue, and it's very important as you proceed through eBenefits that you click Save and Continue on each screen so that your information is registering in and updating. Again, here's Confirm Personal Information. This is very much like the My Information slide out we saw before. If you need to make changes, you can click the pencil icon to go in and make those changes. And we do have, very specific documentation that shows this online. But again, City College of San Francisco or Unified School District employees, you cannot update your information, but you can at least see if we have incorrect information for you. So for the rest of us, we could go in and we could make, whatever changes we wanted here. Actually, not change that to 4.3 in my address. Save it, and then it updates. So that's and then now we see that I've just updated that address, and then you click the X to come out. So this, and there it is, it's showing updated here. So that is all there is to updating either your address, your email, or your emergency contacts. I'm going to click Save and Continue. And now we're getting into the fun part. We're going to go take a look at our medical elections for the 2022 plan year. And so where we are here is something that is showing me my current elections. And some of these you cannot make a change on if you're Superior Court or City and County of San Francisco. They are employer paid benefits such as a life insurance policy or computer vision care. So we list them for you so you're aware you have that benefit, but you won't be able to make changes because they're provided to you by the employer. And then, as I said, for everybody else, medical, dental, vision, although we don't do dental for community college or school district. What this is telling me is if I made no changes for 2022, but I kept everything the same, so that's why it's all in green, kept the same election, kept the same coverage level, here's what I would pay in 2022. So that's what this screen is telling you. For some of you, when you come here, you already may see that you've got a new election and it's in red showing a change. We're changing administrators for our PPO plan in 2022. It's moving from United Healthcare to Blue Shield. And so that's why if any of you are enrolled in that plan, you'll already see, even though you're coming in for the first time, that it's showing a change is happening because we've done that one for you. So then at the bottom of this page, it says, do you agree with the new elections shown above? If you don't intend to make any changes, you can just say, yes, I agree. And then you click Save and Continue, and it'll fast forward you all the way to the end of this. And for some of you, that might mean you don't have to take any further action other than to submit, although without any changes, you don't even have to do that. But for the rest of you, if you don't want to change your medical, dental, and vision, and we administer your FSA, if you say you agree with what you're seeing here, it fast forwards you to the FSA screens that we will look at. But that's because you're required to re-enroll in FSA every year. Whereas for your medical, dental, vision elections, we do what's known as a passive enrollment, and your enrollment elections would just roll over year if you do not make any changes. I'm actually going to say, no, I don't agree with this because I do want to make changes to some of my other elections. So let's take a look at what we see now with some of our navigation. So now I see here where it says health. I didn't have that before. And it's got 3 dots for my medical and basic vision, my dental and my vision premier, and medical and basic vision is underlined in orange right now. And as we move through this, you'll see that I get check marks and that orange bar is going to move along with me. Again, these are just more visual cues as to where I'm at in the process. Regardless of which benefit you're electing, whether it's the vision premier, the medical or dental, these screens are all laid out the same way. First off, on the left side, your link to your benefit guide. And we know who you are. So if you are a retiree, for example, and you click on this guide, it'll open the retiree guide. If you're a unified school district, it'll open your unified school district guide. I'm MEA, so I click on that and it opens up into this MEA, which that's not supposed to work that way. And it wasn't working that way earlier today. It just likes to do that stuff so that let's try that again. Wow, being a little glitchy. I'm going to have to go back and look at that. We made a website change recently in some of our documentation, but that I'm sure will work for you. I'm in a test environment, if you recall. However, these open up in another browser. So really what I want to also be able to show you here is that just look for the tab that says Decision Engine page. And if you click on that, you're right back in eBenefits. So when you're clicking on some of these links, whether it's a benefit guide or whether it's plan documents, it's just going to open up another tab in your browser. And so that's how you can navigate and get yourself back to where you were before. Also over here, it is showing you what your current medical plan election is for the 2021 year. And this is how this works. So to waive, so I'm the subscriber, I'm the HSS member here. I cannot click that box by my name. It won't do anything. That's because my only choice is to waive the whole coverage for myself and my family or keep myself enrolled. So if I click on that, you'll see this little box here that said it was member only, changed to waive. If you're currently waived, but you don't want to be waived in 2022, you now want to enroll in a medical plan through HSS, you just click that button to deselect it, and now it's showing member only. Likewise, for your dependents, however many you have listed here, and if you added a new one, they're listed here now as well. Put a check mark by those that you'd like to enroll. You see that my coverage changed from member only to member plus one. Or if you have a dependent enrolled currently and next year you want to disenroll them, click the checkbox by their name so they are no longer selected, and that's how you disenroll one of your dependents. You'll also notice that as you're making those sorts of changes, data down here is updating, so I'm going to show that to you. First of all, we have 5 medical plans for our active population in 2022, so it's a lot to fit on one page. So you're going to have to find this right caret here, it's in a dark blue, so that you can page left and page right to scroll through all of your plan options. I had clicked waive, and so it's not showing that I was currently elected in anything, but I'll show you what I'm talking about when I get to the dental screen. But essentially when you first come here, if you've made no changes, it shows you what you're currently elected in. I'm somebody who's an MEA with flex credit, so that's why you're seeing negative dollar amounts as I make my elections. It chips away at that money. But what you'll see is it's saying, you know, I'm going to have $373 in credits left. But if I were to change and actually enroll my dependents, so that's obviously I got to spend more money on my premium, you can see that these dollar amounts updated because now it's down to 116. So this is dynamic, and that's how that works, is it's updating your elections as you go. Within this section, we have some text, a brief description of each of the plans, and these blue buttons at the bottom, they all work the same way, but the top button that says the name of the plan, that is going out to our plan documents on the San Francisco Health Service System website so that you can read in detail all about the evidence of coverage, the summary of benefits, and your summary of benefits and coverage. And again, that opened in another tab, so I'm just going to find that Decision Engine tab and go back. So I may, you know, I can leave these open if I'd like to toggle back and forth, or these other tabs you're welcome to close. And then the second link always goes to a microsite we have with our providers. And so here's where you can go to that provider site. You can find more about, you know, what are their services, where are doctors or hospitals nearby me, and you can do a little bit of learning about that particular provider's services. So that's how those work. I'm actually going to choose, this HealthNet Canopy Care HMO, the new HMO we have for 2022. And I do that by, at the top here, I'm going to click the blue where it says elect this plan, and now that's changed to currently elected. I want to show you one more thing. Up here's my my shopping cart, and you can always drop this down or drop this up. And right now you're seeing how it says Kaiser member only. And I have just selected Health Net Canopy Care as member +1. That's because you always have to save and continue. Again, that's what's registering those things you're clicking on. They're not registered till you do this. So now that I'm doing that, it's writing that information back. And so as we get into the dental page and I go look at that shopping cart, you're now going to see my dollars have updated. And I'm going to come into my shopping cart and I'm going to see, oh, yep, there's that Health Net Canopy Care member +1. So here's another place you can go as you're stepping through each part of eBenefits to get a sense of where you're at with your out-of-pocket costs for your contribution to your healthcare premium. Here's
Rin,
that. Yes, go ahead, please.
Hi, Rin. Yes, this is Holly. I'm just looking at our time and wanting to know if you'd like to go through a few questions now. It's 5:45, or shall we wait just so that anyone on the call knows that the Q&A, the live Q&A is coming soon?
Let's do some questions now.
Okay.
We'll mix it up a little. Yeah.
Okay. So this one is about vision. So one of the callers is for their vision, it lists it's waived. And does that mean that the family currently has no vision coverage?
Good question. Let's go ahead and look at that. So there's two places. There's basic vision, and that comes with your medical. And so if you're enrolled in medical, you and any of your dependents that are enrolled in medical have vision basic, or also known as basic vision. But anyway, that covers, your eye exam every 2 years, and you can go look through your guide and all your materials about the specifics that you get in terms of contribution towards your frames and your lenses and all of that item. But we at the Health Service System also offer a benefit called Vision Premier, and that might be where you're looking. So let's go take a look at that next, and I can speak to it when we're on that page. Dental, I'm not going to make any changes to dental. And so here's what I was talking about before, because I wasn't clicking on anything on this page like waiving. I've come in here for the first time, so it's showing me my dentals, what's currently elected. Everything works the same on this page with the links at the bottom to go to your plan documents and learn more about it, a link to your benefit guide, information about your current enrollment. I'm skipping ahead. So let's talk about Vision Premier. This is a buy-up benefit. And so it doesn't exist as a standalone product. It's buying additional coverage on top of the basic. So you have to, for starters, be enrolled in medical with that basic vision to even choose Vision Premier. And I've got a message showing up on my screen. It might be a little hard to read, but what it's saying is my Vision Premier coverage has been modified to match my medical coverage. And so what happened is it used to be that I was only employee only in my medical with my basic vision. And so I had the Vision Premier because I do wear eyeglasses and I like that benefit. But I went ahead and enrolled my dependent in medical. And so because of how Vision Premier is an add-on component, it's an all or nothing deal. So if I want it, then my dependent child also has to have it. I can't decide, oh, I'll just have it for me and not for them. I'm guessing where you're seeing waived is really on this Vision Premier page, so that it's looking like this. And this just means that you're waived for that add-on. But as long as you're in medical, you do have the basic vision. If you were waived in this last year and you're like, you know what, I actually want the Vision Premier this year, it is all, the buyout portion is all employee or retiree paid. But if it's got the higher contributions, the annual eye checkups. If you decide you want that, what you'll do is you'll click the checkbox by waive this coverage so that you're deselecting the waive. You'll have to enroll anybody who's in medical, and we will validate that. And then the other thing is you still have to click elect this plan, and that might not be so intuitive because on all the other pages, we've got the 5 medical plans, the 3 dental plans. Of course, you have to tell us which one you're electing. But here you also have to tell us, even though there's only one Vision Premier plan, and that's because by clicking on elect this plan, you're authorizing that election, and it's also saving the change in the system. And so until you see currently elected and then the all important save and continue, then that's what guarantees we have it. And as we step through these final couple of pages, you'll also see how we can review and make sure what you think you're enrolling in is what you have.
And Rin, just under the health benefits, there's another question coming in. It looks like David's on the line and can't seem to find the benefit guide button on their screen.
Oh, all right, David, let me show you. This is a great excuse for me to show you how you can navigate back around, even though I'm, this is, I don't know if you have an FSA page. You may not, unless you're a CSF or core employee, but let's say you're somebody else. I can, like USD. If I go to any of these pages, they all look the same. So if I'm on my medical page, for example, just on the left-hand side, there should be a benefit guide link. If that link, if you're not seeing that link, I certainly am curious as to why, and we'll have to have you put that in the chat window, but that's where it should come, where you should see the link. But if you're still having some problems with it, go to sfhss.org. That's our webpage, and click on either the Learn More button or the picture. I like clicking on the picture. And as you scroll down our open enrollment page, you're going to see pictures of the little benefit guides based on who you are. So if you're a unified school district, for example, I'm going to click on the picture of the unified school district. And then I'm going to scroll through, because at the very bottom here, they do have the PDF of the guide. And so here it is opening up, and then you could look through it. So, but you should, on the medical, dental, and vision pages, you should see this little button for benefit guide. And that's how you can click on it and pull up that same document that I did by navigating to sfhss.org. So let's just take a quick look about how flexible spending account enrollment works, then we're ready to review and submit. Because you do have to re-enroll in your FSAs every year, and USD or community college employees, you will have to refer to your employer for your enrollment in your FSA. We do not administer your FSA. But so this one does require the active enrollment. I'm going to click Enroll in Healthcare FSA, and it tells you your annual pledge must be between $250 and $2,750. If you try to put in a dollar amount that is not within those bounds, you will get an error message, and that's fine. Just go back in and make sure you put in an annual pledge that falls between those $2 amounts. We also tell you what you had elected the prior year, which really means the current year, 2021, but prior to next plan year. So, so I had 800, and next year I'm going to go 500. Here are the links to finding out more about flexible spending accounts. Aren't based on blue buttons, but they're the link in the text. So don't miss that text, but you can link out there and find out what are qualifying healthcare expenses that I can use an FSA for. And that's how you enroll in your flex spending FSA. We also have a dependent care flexible spending account. Again, these are pre-tax deductions so that you can then use the pre-tax dollars for qualified eligible expenses. And for the dependent care FSA, it can be used elder care, as well as obviously child care and preschool and day camp and all those sorts of things. And you can find out more information about those types of benefits on our website. This is telling me I was waived previous year. Again, it does require an active enrollment of clicking and then selecting something between $250 and $5,000. I'm going to deselect that enroll because I was waived last year, and I'm going to stay waived again this year. Now we're just going to go ahead and review and submit our elections. Let me show you some important items here. I'm going to zoom in. So this should show everything we've just done. So I did, in fact, enroll myself and my child in HealthNet Canopy Care. You will see your dependents listed regardless if they're enrolled or not. So the trick isn't to see, oh, is their name there? But right here, there's a covered yes/no field. You really want to check if is that a Y? Is that supposed to be a Y? So for me on the health benefits, my child is covered, but as I scroll down, just because their name appears under my dental, their coverage is N. They are not enrolled, and that is correct. That is what I did. If any of these are incorrect, you can click the pencil icon, and that'll take you right back to that page. So this will then take me back to dental, and I can, if I did in fact want my dependent in dental, I can make that change. Again, I need to make sure I save that change. I'm going to save and continue. And this will either make me step right back through every screen to get back, or we can shortcut there. So instead of me, saving and continuing through every single screen, which I'd rather not do, I know I was in the middle of review and submit. And of course, here's our breadcrumbs have turned green on the benefits because we got through there, and I'm on this step right now. I'll just go there to get right back there. Again, I'll finish reviewing, and then if everything here looks like what I expected, then I'm going to continue. And we're up to the final page here where I'm going to submit those elections. There is a whole lot of text on this page, so let me give you the short notes on what's here. The first part is really about authorizing deductions from either your paycheck or your pension towards your healthcare premiums. The next two parts are arbitration language. So we have arbitration language from Health Net Canopy Care, and also Kaiser Permanente has arbitration language as part of your plan agreements for enrolling with these carriers. By clicking submit, you agree to all of these terms. So if there's any part of this that is not agreeable to you, for example, if you don't want to be bound by the arbitration agreement, then you can go back and select a different plan. You're not able to proceed with these, the Health Net Canopy Care or the Kaiser Permanente without agreeing to their arbitration language. So that's what happens here. But I'm okay with it, so I'm going to click submit. And by clicking that submit button, you now have actually sent your elections to the health service system, and you'll see I got that final green circle there. There's a enrollment completion statement that you can print out, and we encourage you to do that because by the first week of December, you will get your confirmation statement from us. And if there's any errors, you'll have this document to refer to. But also know that we do review your enrollment elections, and so they're not finalized until we've reviewed them. So for example, if you had added a dependent, but we didn't get the correct supporting documentation from you to confirm that that dependent was eligible, then we may change your benefit elections and drop them. But even though it says to print a confirmation statement, you don't have to print it out anywhere. I mean, especially if you're on your phone or your tablet, you could just save it as a PDF to your machine so that you've got it for another time. So, you know, I'm just going to save my benefits so that I will have them for my own records, you know, and it tells me like date and time that I did this. And I'm going to X out of there. A quick look at uploading documents. So if in fact you did add a dependent, this is the part that's important that you give us that supporting documentation. And let's take a quick look while that's loading about what that might be. So the types of documents we're looking for, if it's a new spouse, or your spouse may not be new, but you may never have enrolled your spouse with us before, so we're going to have to see that certified marriage certificate. If it's your domestic partner, we need the domestic partner certificate. Children, we need birth certificates or adoption certificates. And again, as I had stated before, we do require that Social Security number other than, you know, if it's a newborn. So flipping back over here into eBenefits, and we do again have step-by-steps on how you do all these things we've done today in this webinar on our website, including going through all these steps to add an attachment. But I click the Add Attachment button. And then I'm going to click it again, and I get this highlighted fields are required. So if I didn't put a subject, it's telling me you've got to give us a subject. It's a required field. So my dependents, you can call it whatever you want. And then I'm going to click Add. And I'm going to look on my computer or wherever I have this, if it's a picture I took on my phone of the certificate, for example, I'm going to find that document. And I'm going to click on it so the name of it appears here. And then I'm going to click on Upload. And then once I click on Upload, I'm then going to, the name now shows here as attachment, so that's great. And I click Save, definitely have to click Save. It says it's saving the page. And now just below here, I'll see my document listed. Now, as it happens, I have a lot of documents because I'm in here doing a lot of training and testing, but here's the one we just did. So you may just have one item here. Here we are, October 25th, 5:56 p.m. And I know we're trying to get a lot of information here for you, so we will stick around and ask a few answer your questions beyond the top of the hour if people still have questions. I'm going to click X to get out of there. And I'm going to save and continue. If you're a Superior Court or a city and county employee, we tell you how to get to your voluntary benefits. There's a page here for Unified School District telling you where you need to go for your additional benefits that are administered by your employer, and same thing for community college. And you have now completed your open enrollment elections, everything you saw about this workflow is the same exact thing you do if you're doing a life event.